A survey obtained by Checkpoint has revealed 98% of 272 nurses at the county's Manukau DHB have experienced short staffing. The survey undertaken by the New Zealand Nurses Organisation revealed 93% felt they had, and I'm quoting here, reached the limits of safe practice as a result of those staff shortages. It comes after this program revealed last night that voluntary redundancies were about to be offered at the county's Manukau DHB. County's Manukau says voluntary redundancies would free resources for redistribution to frontline care. This would include Middlemore Hospital. We invited the Ministry of Health, the DHB itself and the Health Minister on the program tonight. None of them were available. The Ministry of Health is consistently not available and has consistently not been available throughout our 2 months of looking at DHBs and their fiscal positions. New Zealand First doesn't currently have a health spokesperson. Julie Anne Genter is the Green Party's health spokesperson and she joins us on the phone now. Are you there?
Kia ora.
Kia ora, nice to talk to you. You also had the experience of going out to Middlemore and taking the photo that was widely circulated on social media saying essentially the hospital was full, right?
Yes, that was probably about a month ago now. I heard from a regular volunteer who volunteers at Middlemore Hospital that they were taking the unusual step of removing couches and chairs from some rooms to create new space to deal with patients. And this wasn't just the emergency department that was doing it, and that there was a sign out the front saying the hospital was full. And of course, once I shared that on social media, other people came forward with stories saying they'd seen that sign before in the previous few months. So it wasn't a new thing.
Okay, so we now have a survey of nurses who have participated in it, who are members of the union. Of 272 who answered this question, 267 said they had experienced short staffing in the ward or as a team, and then 246 of them said they felt they had reached the limits of safe practice as a result of staffing shortages. Is that good enough?
Absolutely not. I think it's outrageous and very concerning, but it's also consistent with what I have heard from people across the sector over the last year. And of course, it completely contradicts what Minister of Health, National Party Minister of Health, Jonathan Coleman has been saying, which is there's no problem with underfunding of the health system.
So you're suggesting, and certainly people have been telling us the same thing, this is not unique. These kind of pressures, this kind of survey response is not unique to Counties Manukau.
That's what I've heard. Now, Counties Manukau might be in the worst situation. I mean, it's a very high-risk population, high-need population, and of course Auckland has experienced a lot of population growth in the last few years, which has not been met, I think, by a commensurate increase in funding for health services. But I think you'd probably get a similar response at Auckland Hospital and other hospitals around the country.
What needs to happen?
Well, I think we need a new government, but we also need a change. And I think this is the logical result of an ideological approach, which says we're going to ask people to do more with less. And there's only so long you can squeeze down on the people who are providing health services and ask them to perform their duties until the whole thing starts falling apart.
Julie Anne Genter, who's the Green Party health spokesperson, joining us live on the phone. The Minister, the Ministry and the DHB were not available.